Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, Chief Medical Officer of Good Samaritan Physician Network. With me, as always, Adam Thacker, who's our Chief Operating Officer of Good Samaritan Hospital, and also a pharmacist, which has come in extremely handy over the course of the past year, I might add. We'll be giving you our usual weekly update on the status of COVID-19 in our community, talking a little bit about statistics, what's going on with the vaccine, what numbers have been in our community, and just kind of lead off with, we always talk about the numbers. Around 3,000 positive cases since we have begun, but the more important numbers are the positivity rates. So positivity rate of all individuals around 13%, which is in line pretty much with what the state number has been, and around 29% for those unique individuals. And we've seen that number almost as high as 40% basically if we look over the course of the past month or so. But the important thing to look at is how many active cases we've had. We've been up in the 300s over the course of the past month. We're now down to around 181. So those are some encouraging facts that we look at in terms of our hospital utilization, how full the hospital is, how full the ICU is. We kind of look to those numbers as surrogates to determine just how bad things are as far as the community infection rate, but also how busy the hospital is. And actually things have been better as far as the hospital numbers lately.
Yeah, the numbers are a starting point, but within the healthcare world, we look at what are the day-to-day pressures on our ICU, on ventilator capacity, patients coming into the hospital needing that level of care, and we're in a period right now that we're able to take a breath and say that our inpatient census for COVID is lower than it's been in the past month or so. The stress on our resources from staff to ventilator needs is lower. We've always been able to maintain a consistent capacity to where we could care for patients as they came in through the ER or through one of our medical practices. But we're at a point right now that things feel good. Now, you and I talked a little bit before, we're also in the winter months, and we know that there is a flu season that is still yet to ramp up to what we typically see as our peak, and we've started to see a little bit of flu, and we don't expect this to last. This is not a we're out of the pandemic type of conversation, but it certainly is one that we're happy to report that the pressure on our system is a little bit lower. And then when you look at it from a state level, we went from red to orange, and I know if there's anyone on here that studies those numbers closely, you could look at it and say, hey, we're trending towards yellow, but we don't want to get too far ahead of ourselves that we're there yet, because we still have 181 active cases. We still are seeing 200 plus cases per 100,000, even though we were up in the 5, 6, 700s. And our positivity rate is still fairly high, so we're seeing we'd still be classified as a sustained transmission across our community. But all of the conversations we're having today are much better conversations to be having than 3 weeks ago when we were very close to telling everybody you got to just stay at home.
Yeah, and really looking back, we've talked about this from the beginning. It's easier to look back at the curve several months later to see when the ramp up occurred. And really looking back to October is when we saw that exponential growth in number of cases, and then we have seen this peak occur basically right around the beginning of December, and the numbers start to come back down. So we are cautiously hopeful that we continue to see those, and as we see those numbers dropping and also the vaccination process proceeding very well, we're encouraged to talk a little bit about what the next few months are going to entail. So really the vaccine started approximately 3 weeks ago. Those of us that got the vaccines on the first day are coming up on our 21-day number over the course of the next 3 or 4 days. So that's rolling out very well. Number of vaccines administered has been really tremendous in the last few weeks or so.
Yeah, we've given over 1,800 vaccines. As you mentioned, this Thursday will actually mark another historic milestone in the COVID vaccination program, where we will administer our first set of second doses to complete the 2-shot regimen for those initial of our healthcare team that were vaccinated. So that's exciting. Certainly the questions are coming now as to, okay, the healthcare team and extended healthcare teams have had eligibility sent to them, have been coming in to get vaccinated. But as we've talked about, we're still looking at our COVID vaccine clinic as having capacity, and how do we expand upon that. The state is, since the release at a federal level of the what are called ACIP guidelines, Advisory Committee on Immunization Practice, the state has now looked at those and is in the process of making those next determinations. What we expect is that 75 years of age and older will be in that group, as well as essential workers. Now, what we've been told from a state standpoint is the group that was identified federally is a enormous group, a larger group of Hoosiers than we have vaccine. So it will not be word for word the same as the federal. It will be what we call sub-prioritization. So they will look at that total group and say this is the first group that it will be rolled out to. And then based off of uptake, so how many are getting vaccinated, how many vaccines do we have, that will continue to roll out in a systematic fashion. We also have, towards the end of January, another vaccine that should be coming on board, and then in February a fourth one, and that certainly is a game changer from a supply-demand relationship. But as far as the questions that I know are around, when is it my turn, when am I in line, that is starts at that federal guideline and then is revised by the state. I won't get into all the various states, but as you've probably seen in the news, many states have chosen to go very different pathways. Indiana is going to closely follow the guidelines, but in some sub-prioritization to make sure that we have enough vaccine for everybody as it rolls forward.
Yeah, and just the volume of vaccine that we have received has been better than we anticipated. Yeah. The rollout, the speed with which it's been administered has been better than what we expected. And really, the question on everybody's mind when we started this was, is the vaccine safe? How's administration going to go? And that's gone extremely well. So other than a little bit of injection site soreness, which is fairly commonly reported, we've seen virtually no adverse reactions as far as the administration of the vaccine is concerned. And that's on a lot of people's minds. We get the question nearly every day in terms of, did you get the vaccine? Are you going to get the vaccine? Is your family getting the vaccine? And the answer is yes. Both me and my wife have received that vaccine already, being healthcare providers, and the plan will be to continue to roll that out as Adam has described. The vaccine has been very safe. The other thing that has come up, of course, is what if you have recently had the illness? What about administration of the vaccine? How does that play into things? And what we have encouraged people is if you have had the illness within the previous 90 days, it's perfectly fine to wait on administration of that, but it's also okay to go ahead and receive the vaccine at this point in time.
Yeah, so what we're talking about in that 90 days is natural immunity. So there's an expectation if you have had COVID and have been deemed as recovered that your body then generates antibodies, which is what the vaccine also creates, is an immune response. And so you have natural immunity during that 90 days. It is not a pass that you should not get vaccinated. What it is we have to look at, kind of gets back to supply and demand, the number of vaccinations we have, and we want the most Hoosiers possible, or healthcare workers that are within our region that we cover, to get vaccinated and to have some protection. So somebody that has not had COVID, has zero protection, needs to be first in line. Somebody that has had COVID, you have that 90-day natural immunity grace period, we'll call it, that you can wait. Now, I will tell you, across our clinic, we have had many individuals that have had COVID that are recovered, back to feeling normal, that have went ahead and got the vaccine. Some of that is because they're eligible and they've said, hey, I want to go ahead and get it, and that is perfectly fine. This is not a requirement one way or the other. The only thing that we would caution, if you have had COVID more recently, let's say in the last just few weeks, and you're still recovering and your immune system has taken a hit while you've recovered, getting the vaccine then is going to put your immune system into overdrive, and you're at higher probability to feel a little worse from getting the vaccine. But again, we've seen across the healthcare work span, we've seen pregnant women, recently recovered COVID positive healthcare workers, older, younger, different health disease, many different facets of individuals getting vaccinated, and all with very little side effects from the vaccine, which is really promising because obviously there was a lot of discussion about how fast things moved and was this safe and was it efficacious and did we cut corners. And I know we've been on here. I know there's been leaders of state, leaders of country that have been on press and releases saying that it moved at the the speed that it did because of the resources brought to bear, not because of taking steps out of the mix. And that really is holding true thus far.
Yeah, and really the thing that got everybody ahead of the game in terms of developing this vaccine was the unlocking of that genetic code of those spike proteins on the outside of the virus. And so when you read and hear about this, there's been a whole variety of methods for making vaccines over the years, using live vaccines that have been attenuated, killed vaccines, those types of things. Basically, because of the technology that we have nowadays, they're actually able to determine the genes that outline what those proteins are on the outside. And that's how that viral particle enters our cells. And so that mRNA technology essentially is addressing that. That was unlocked very early on and then was shared throughout the entire world to help develop this vaccine. So that process in itself put things way ahead in the process of determining how to develop this vaccine. Now, the question on everybody's mind with the question of mutations coming on and genetic drift and things over the years, what's going to happen and how efficacious is this going to be? And the answer is we don't know yet. However, it's likely that this is going to last for many, many, many years, and there likely won't need to be booster doses and things like there would be with typical vaccines. However, all of that is in process of being studied right now. And from the first people that are getting vaccinated, from the people who had the illness back at the beginning of the pandemic, all of those types of things are being researched to determine how long does natural immunity last, how long will the vaccine-based immunity last, will there need to be booster doses, are there going to be certain age groups that will get that? And the answer is we don't know that yet.
Right.
But the process is in play, and thankfully we know that this is very efficacious, and compared with a lot of other vaccines, it's almost unheard of to have a vaccine that's 94 or 95% efficacious. You and I have been through years in past where the flu vaccine has been as poor as 40 to 60% efficacious. So to have something brought to bear at the beginning of this right now that's 95%, 94% efficacious is tremendous.
Yeah, and I think mentioning that this is at the genetic level and the spike protein, one thing, so questions other than vaccines, the hot topic that has came up has been the mutation, the new variant of COVID, and I've read that there's been up to 19 different mutations that have been identified from a variation standpoint. What we know to date is that as soon as that was identified in the UK, and now there's been some cases identified in the US, not in Indiana, but in the US, is that it was immediately studied against the vaccines. And what they found was thus far those mutations the vaccine has been effective against. Now, not to get too detailed in the science of it all, but mutations happen again and again and over time. And for a mutation to take enough change to evade our body's immune response and antibodies and vaccinations will take years, or at least theoretically it will take years. There's not just one single mutation that it's all of a sudden vaccines and treatments and your body, or you're starting over from scratch. It's very small incremental changes. And so because we're identifying that spike protein on the outside of coronavirus, it is believed that these mutations, while they will continue to happen, that is just the evolution of viruses and life, is that there will be mutations, is that the vaccine currently will continue to work against many mutations.
Now, one thing that we've spoken about in the past, and we want to reemphasize, of course, is the importance of getting tested, and those individuals that are eligible for treatment with the monoclonal antibody get identified early in the course of their disease process. So although the vaccine administration is going quicker than we thought, the numbers have been better than what we thought, there's still going to be weeks and even months that go by before we get that critical population of people vaccinated that are the higher risk individuals. So people with diabetes, people with cancer, people with immune system problems, people with chronic respiratory problems, people with chronic kidney disease. All those individuals still are going to have many weeks until they are fully vaccinated and will have received a 2-shot series and have developed their own immunity to that. So during that period of time, it's important to realize that if you get the illness, it's important to get tested, get identified early in the course of your disease process. And the monoclonal antibody that we've been administering for many weeks now has been very efficacious if administered early in the illness. We've been trying as best we can to get people identified in the first few days of their illness, right, certainly before a week, and get that administered. And as far as the administration has been concerned, we've been using 2 products so far, which have gone well.
Yeah, we started off with the bamlanivimab, which is a Lilly product, so it's here in Indiana, and that helped with the distribution process. And then Regeneron, the combination product, was made famous with President Trump's treatment and the investigational process. Both we have seen exceptional results. Both we have seen very low side effects, something that would be similar to an infusion of normal saline fluids, just kind of typical medical treatment side effects that are managed right there. And we have seen just one hospital admission, and we're at 180 plus patients being treated with this treatment. And when you look at this population, there is now good data to say 20-30% of this population end up hospitalized.
Right.
So that's somewhere in the ballpark of 30 individuals that would have needed hospitalization, additional care. From one side, that means a patient in the hospital, and that's hard on anybody. And from the other side, that's resources for our healthcare team that have to be expended. And now we're able to give this treatment, and certainly there's resources put into being able to facilitate the treatment. But it starts with getting tested. And then the other component is, right now, this is a federal funded program. So there's an administration cost to the patients as far as that's charged to insurance and such as far as getting the treatment. But the drug is being provided at no cost. And these are expensive medications. Monoclonal antibody infusions are expensive. There are many of them out there for many different treatments. But right now, that is of no cost. And that's similar on the vaccine side. That is through a federal program, and there is no cost to the individual getting vaccinated. We do collect insurance information. That's for the administration charge, but again, there's zero patient out-of-pocket cost. Really, and that is geared at, we have monoclonal antibody treatment, we have vaccine process rolling out, and we need the financial picture for individual patients to be a non-factor. And so really kudos to all the way up to the federal folks that are making those decisions to remove that barrier.
Yeah. And as far as testing is concerned, we have a couple different types of tests, but the important thing as it pertains to this discussion of the monoclonal antibody is we want those patients with symptoms who are in those higher risk groups to get identified, see a provider either at our convenient care clinic or with their primary care provider, and get that rapid test ordered. That rapid test comes back just within a few minutes or so. We can then make those critical decisions on whether or not that patient is appropriate for the antibody infusion. Some patients have come to me saying, well, I went and I got the test performed. They told me it was going to be several days before it came back. It's important to stratify those patients into those higher risk groups and identify them and say, hey, you're a person that would potentially be a candidate for that antibody infusion. That's what we're doing in our primary care offices. That's what our emergency department is doing, and that's what our convenient care clinics are doing, is trying to identify those people early on, get them that rapid test performed, get those results back, and then that same day make that decision to get them lined up to receive the antibody infusion.
Right. We've really been able to secure supplies to be in a good place where any individual coming in to those sites that you mentioned that is symptomatic, symptoms consistent with COVID-19 as assessed by our providers, will get that rapid test that will be resulted in 15 to 20 minutes. Asymptomatic, screening for surgery, asymptomatic, traveling and needing a test, or just you are a contact and want to know, curiosity, those asymptomatics will be the molecular test that is sent off, and that's a 3-day turnaround time, which has been pretty consistent for the last few months that we've been able to maintain that turnaround time.
Sure. So we're coming out of the double hit here on the holidays. We get Christmas, we have New Year's. Kids are out of school. Kids are about to re-enter school. So let's talk a little bit about one of the highlights, I think, of all of this has been how good the schools have done, how excellent the students have been, administration in keeping things ratcheted down, following the rules, and doing really well, to the point where there have been virtually no positivity significant rates within the schools.
Right. Yeah, since the onset of this past school semester, we've been really impressed with how they have handled it. All of our county schools set up their plans for how they would respond to symptoms, how they would respond to known positives, and they have followed those to a T. And sometimes that has meant that classrooms have been quarantined, sports teams have been quarantined, a group sitting at a lunch table has been quarantined, but they have followed that, and school has been able to maintain a sense of consistency with the vast majority of learning being able to be provided as in-person learning. Now, as we come out of, as you mentioned, the double hit with the two holidays and the break, we have two of our schools that are returning to in-person learning this week, or two of the school systems, and then two other school systems are returning mid-January to in-person, but they returned today to remote learning. So ideally, by mid-January, we're back to an in-person learning environment, and something that we can hopefully keep through the semester. But again, those plans that have been put in place have really worked well to identify when there's an issue, when there is a need to make an adjustment, and they've done that and been able to keep, by and large, school in session and continue to give the kids not only that social interaction but also the educational component.
Yeah, tremendous, compared with where we started at the beginning of the school year, where the word on the street was we were going to be in school for a week in person. Everything would go virtual after that. Great appreciation to the school systems, their administration, and the kids for doing what was right and following procedure and doing a great job of controlling that within the school systems. As we have moved along over the last few weeks or so, we've gone from a red county to a burnt orange county, perhaps. You want to talk a little bit about what that means and kind of the implications for the next few weeks on that?
Sure. And tied to that color coding, want to mention, because I know it's gained some publicity, that the state identified there was a calculating error in their color coding map. There was not an error in the number of cases reported per county or the number of deaths or anything with the raw reporting. So it's easy to look at it and say, it's not being reported accurately and something's being hidden. It wasn't that. The raw numbers were all correct. The error was identified in calculating positivity rate. So that was corrected, and then drastically overnight the map changed, which there are many reporters across the state that are looking at that, and they started asking questions. And I'm not familiar with exact details of what the error was, but it has since been corrected. Knox County was red. We are orange. We've seen that trend kind of in line with active cases and positivity that we talked about move to the lighter side of orange, which is good, and we continue to follow that. Now, as far as restrictions, the recommendation has been, if you've been red and move into orange, that you maintain the same restrictions for a period of time to make sure that everything holds true. As we mentioned, our positivity rate, 13.3%, still seeing that sustained transmission. So I know, for example, here at Good Samaritan, our visitation policy has not changed. So we are minimizing our visitations in ambulatory ancillary settings for only those that have to have somebody with them for medical decision making. And then on the inpatient side, that's really stayed the same from 10A to 6P. One visitor is allowed for our inpatients, and then there are exceptions made for pediatric patients and different populations that need a different care system. But certainly trying to balance that in the healthcare setting of family and loved ones being there during a healing process with keeping everyone safe and healthy and minimizing transmission, because even though the vaccine 95% effective and monoclonal antibodies treating a lot of individuals, we know that staying away from COVID is 100% effective. So as much as we can eliminate traffic and keep that, we're still in that period of time for the next few months where we need to do that.
Yeah. As we spoke about earlier, it's important to realize that separate from the pandemic, we are heading into what we would generally consider our sicker months of the year anyway. Right. When we normally look at hospital census and ambulatory volumes, this is a busy time of year because of adult-based illnesses, influenza, pediatric-based illnesses, gastroenteritis, RSV, those types of things. Now, we would anticipate that those numbers are going to be better this year because of all the precautions that are being taken because of the pandemic. But it's important to realize that this becomes some of our sicker months, and we want to encourage people and make sure that they understand that if you are ill and you are not able to sustain yourself, meaning eating, drinking, ambulating, getting around, doing the things that you normally need to do, it's important that you get evaluated. One of the things that we saw early in the pandemic was people withholding their own medical care and staying at home. And there were individuals that stayed at home and had ruptured appendixes. There were people that stayed at home and had heart attacks, and people that stayed at home and had strokes. So it's important to realize that we want people to come in and get evaluated if they need be. That being said, we have a whole host of virtual options in terms of telephone visits, FaceTime visits, Zoom visits, things I probably haven't even heard of yet. But the great thing is it's easy to get hooked up with a provider and get evaluated in a safe manner right now. And it's continuing to be a safe place to come and get care in terms of your surgical treatments, interventions, hospitalizations, things like that. So realize that as we go into these next few months, even though you would be concerned that this is a sick time of year for most individuals, that it's still important that you get evaluated with that. That being said, the other thing that's important is everybody's mental health. Post-holiday period of time is very difficult for people because it is the darkest months of the year, the coldest months of the year, the least active months of the year. The bills from the holidays come in. All of these types of things are difficult for people. Add to that what has been happening with regards to the pandemic, and it's easy to get mired in the depression that goes with our darker winter months here in the Midwest. So please be in contact with your providers or your mental health professionals. If you need services, we have those available as well. And I would encourage people to come up with an exercise program that they can participate in through these winter months, because that helps to stimulate those chemicals in our brain that make us feel better. It's also important to have something to look forward to. And I think a lot of us have been pushing off that, well, what is there to look forward to? Well, we have seen a lot of progress over the course of the last few weeks with regards to the monoclonal antibody infusions, with regards to the vaccines. And I can say with great confidence that as we go towards spring and we go towards early summer, that we are going to return to some normalcy. The speed with which we return to that normalcy is still unknown, but I want people to realize that there is something for us to look forward to. So start planning those spring break trips, start planning those vacations for the future, so people have something to look forward to. We want them to realize that things are better than what they were over the course of the past few weeks, and to look forward to what we've got coming. Any other things before we go to the phones?
Well said.
Many of the questions are some things you guys have already talked about, so just reiterate how or when can senior citizens get the vaccine and where?
So the when is being determined over the next couple of weeks. And that is a state directed, based off those federal guidelines, state directed. So that's not a local decision making process that Good Samaritan makes or that your local health department makes. Now, what we do know is in concert with Dr. Stewart that the local health department will be providing COVID-19 vaccines in the next coming weeks. They're looking at next week and being able to receive shipment, and then we'll be setting up a process to provide that. Our COVID vaccine clinic that's here at the hospital will continue to operate for the foreseeable future. We don't have an end date. We will continue to move forward with that. We do anticipate 75 years of age and older and essential workers, but again, if you look at what's out there on the web with the overarching guideline of all essential workers, we do expect that to be sub-prioritized to some degree and then rolled out in a phase-wise with the ultimate goal we're still working towards by that March timeframe to be able to offer the vaccine to high-risk individuals, to that 75 years old, to essential workers, and then after March move into what's called phase 2, which is more of the healthy general public that will ideally be able to even get that at their medical practice, their primary care provider's office, rather than have to come to a mass vaccination clinic.
Okay, and you also touched upon this earlier, but is there a timeline or suggested date that post-COVID healthcare workers register for their vaccination?
Yeah, so that's that 90-day grace period, if you will, with natural immunity. If you have had COVID and recovered from that, then you've got 90 days from that positive test that you're expected to have some natural protection. That is a consideration. It's not, I wouldn't call it a recommendation. It's certainly not a requirement. It's just something to consider. Right now, we've been fortunate. We're continuing to get vaccine at a pace that we're able to continue to push forward with vaccinating more and more of our community. But certainly that thought process is geared around individuals with some natural protection versus an individual that's eligible that has zero protection. Right. We want them to step up, roll up their sleeve, get the vaccine, and get some protection going. On the age group, just to jump back to that real quick, we have set up on our website a COVID vaccine FAQ, an informational site the second we get that information, we will be a communicator in pushing that out to who's eligible, what that process will look like, through our primary care offices, through our clinic, et cetera, a lot of resources. So you don't have to be sitting by your phone. You don't have to be waiting for the state to call you. We'll get that information before it will be publicly released, and then Good Samaritan, as the regional healthcare provider, will communicate, but we have to be given the details and the green light from the state to do that.
Okay. Is there anything we can take to help from getting the virus? And if you have it, what can you do to minimize its effects?
Sure. So there are all kinds of things that are touted as potential preventatives and treatments and things that you can do. The most important thing, though, is eating a healthy diet, getting adequate rest, staying hydrated, and then, as Adam was talking about, it's important to just follow the normal guidelines that we have pushed from the beginning of this. Taking massive doses of zinc or massive doses of herbal this or vitamin C or so forth, there really aren't great conclusive studies that show that those are helpful. But we know from our own body's standpoint, what keeps us healthy is eating healthy, drinking healthy, exercising, getting adequate rest, and then just naturally separating from those individuals that are higher risk for contracting it. So my advice would be the things that we know that work, that's what we should do first. Anything else beyond that, really, most of those other things that we just mentioned, they're probably not harmful. Taking massive doses of vitamin C, things like that, our body basically just eliminates that if it's excess. But please don't drink pool chemicals, and please don't take strange homeopathic over-the-counter medications, because there's really not great evidence that we have to support that any of that is helpful. But again, early on, identifying if you have the illness, getting tested quickly, and determining whether you're somebody that would benefit from the monoclonal antibody treatment, those are the things that we know and have seen in real-world clinical situations to be efficacious.
Okay. This person says, I live in Illinois, but my primary care physician in medical care is in Vincennes. Will I be able to get the vaccine in Vincennes?
So the current eligibility is for Illinois residents. The current eligibility would only be for Illinois residents that are working as a Phase 1A or what will be Phase 1B essential worker in Indiana. The allocations from a federal standpoint have been released by state. So when we talk about the 75 years of age and older population, the 16 to 64 that is supposed to follow them, of high-risk individuals, population that are not a working essential worker population, that is based off of your residence. So that would be Indiana residents only. That would not be open to Illinois residents. Now, I'm not familiar with the Illinois vaccination program plan, but I know they have one. I know a couple of weeks ago, Illinois was the number one state in the number of vaccinations given. Now, theoretically, a lot of those are given in Chicago. Because
I don't think that's theoretical.
I'm going to stick with that. But that's where the population is.
Coming from Southern Illinois, I can assure you.
Yes. So for our Southern Illinois residents, even though your medical care is delivered here, and we certainly appreciate that, and we'll continue to be your medical provider, the rules around the vaccine availability is based off of your residence of work and your residence of your residence home address. So if that changes, we'll communicate that, but right now that's not an expected change because allocations have been based off of state populations.
Okay. Is there a timeline if I need to take a Prolia shot?
In relation to administration of the vaccine, I'm presuming?
So.
No, we haven't seen any sort of contraindications in terms of administration of those types of agents or other agents. Now, one thing that we did speak about in the past is if there is something specifically that you receive in terms of an immunosuppressant medication or a steroid medication around the time of vaccine administration. And there's not a hard stop in terms of how many days or how many weeks, but if you are on a routine of that, what we would advise is to try to place it as far in between when those doses would be given of whatever immunosuppressive agent that you would receive. That's no different than any other vaccine administration rules that we have had prior to this, but if you get routine steroid injections or routine immune infusions because of rheumatoid arthritis, Crohn's disease, any other type of autoimmune or immune suppressive type medication, we want to separate that as far away from the vaccine as you can potentially get it. But it is definitely not contraindication of getting it. In fact, we certainly want that population to get the vaccine because their immune systems are not necessarily normal.
Okay. Where do you go within the hospital to receive your vaccine?
So our vaccine clinic is located in what's known as our old physical therapy space. For those that went there, it's on the first floor next to our emergency department. At the point that you're signing up for a appointment, there's communication as to where to enter on the 6th Street side. There's signage, and then we have people guiding from specific parking all the way into the clinic. It's very easy access to come in to the clinic and efficiently go through the clinic and then exit without having to go into any other main part of the building. So that is important. If you are eligible and getting vaccinated and coming to Good Samaritan, the health pavilion entrance, which is the main entrance for going to our inpatient, going to our ambulatory surgery, cardiology, most of our ancillary testing, all of those, that is not the entrance for the vaccine clinic. The entrance for the vaccine clinic is off of 6th Street parking next to the emergency department under the green awning. If you go to the health pavilion, you'll get rerouted because, as we talked about with visitor traffic and just decreasing folks in the hospital, we don't want somebody having to walk to what literally is the other side of the hospital over to the clinic.
And there's very specific parking that's laid out in front of that area with cones and signs. Yeah. So one of the easiest ways to determine if you're in the right place is look for that parking area that's available. And then, as Adam said, the green awning that leads into the hospital, that will basically guide you into the location where the vaccines are administered.
Okay. Once vaccinated, can you still spread the virus?
So actually, that's one of those unknown questions right now. So the history of science behind that is suggesting that is unlikely because how the vaccine works with creating that immediate immune system response is that you're able to fight the virus and you don't get clinical illness. And what we know with most viral infections is clinical illness, fever, shortness of breath, whatever symptoms you have is tied to contagiousness and spreading of the virus through that mechanism. But there is rare cases of what's called asymptomatic spread. So it has not been, nobody has came out and said that's absolutely not the case, that you can't spread the virus, but most have said we believe that is going to be identified later. And as we get enough vaccinated and enough recovering from COVID, we create the herd immunity to where your body responds quickly. Then even if there is some minimal spread, we have folks that have natural immunity or vaccine-related immunity.
And really, the only types of vaccines that we have had any concerns for with that in the past have been live attenuated, killed vaccines, things like that. And the technology that's behind this vaccine is completely different in terms of we're not taking the actual viral particle and putting it into the vaccine. It's the genetics that are behind the coating or the outside proteins that are on that are being used. So there's not a functioning virus that's inside this vaccine that's being injected into your arm or into my arm. And so there isn't an ability to do that. Now, the underlying question, of course, is if you were exposed to COVID days before or weeks before, could you potentially spread that? And again, that's really an unknown. But the thought process, of course, is if you get the vaccine, you are immediately forming antibodies. And those of us that received it 2.5, 3 weeks ago, we're forming antibodies now. We may not be 94% or 95% protected, but as we get our second vaccine and move a couple weeks past that, that's basically where those numbers came from.
Right. And so that's a very good point. If you have received the vaccine and then tested days later, and we've had this happen on a couple of occasions, days later tested positive for COVID, you have came in contact with the virus and contracted COVID. The vaccine cannot create a positive COVID test. So in that case, between first dose and second dose, you still quarantine, you still follow all of the guidelines because we haven't completed the 2-dose regimen at that point.
I think Adam and I are both doing our own personal antibody studies. So as we play this out over the course of the next few months or so, we'll let you know how that goes.
We'll report how long we keep those. Yeah, it's a contest.
Yeah.
Are there any changes to the visitor policies in the works?
Not at this time. We made those changes that I referenced previously with really no visitation for ambulatory or outpatient settings, except where medical decision-making, power of attorney type of relationships occur. And then on inpatient, it's one visitor with some exceptions, pediatrics, end of life, those types of things, trying to balance healing process with our visitation. As we have looked at those, safety is paramount and decreasing transmission. And even though our numbers look a little bit better in the county, we still have a pretty high positivity rate. We're still seeing sustained transmission, which is kind of defined as above 10%. We're still well above that. So we have a team that talks about visitation weekly, but there are no planned changes at this point.
Okay, and we kind of already talked about this, but when will all the nursing homes be getting the vaccines?
So, very early on we commented the nursing home process is being facilitated by CVS and Walgreens as pharmacy partners for long-term care facilities and assisted living facilities across the state. They have been given an allocation of vaccine for taking care of that population. Now, we've had a number of long-term care employees come through our own clinic, and that is certainly open to our Knox, Davies, and Pike counties. Any long-term care employee can come through our clinic and get vaccinated rather than waiting on that process. What we have been told, and this is kind of a separate discussion that's going on with the pharmacies I mentioned, but what we have been told from a vaccinating site is that that's expected to happen by mid-January in completion. So we were told as early as this week that should be rolling forward with long-term care residents and staff being able to be vaccinated on site at the long-term care facilities. Certainly that's a high priority for the state. That's a high priority across the country. And I think that process is moving rather quickly. I know the Moderna vaccine getting approved a little bit later than Pfizer was part of the waiting because they are using the Moderna because the transportation of that vaccine is easier to take out to sites and administer.
Okay, this lady says, I am eligible to get the vaccine now, however, I will be out of town when my second dose is due. Can I receive the second dose in another state?
Yes, is the short answer. It's a maybe more involved answer to that. I would suggest that you contact our COVID line, the 885-3331. They can get you to the right person, and we can talk about how long you'll be out of state. Is it a day? Is it indefinitely? We give everybody that comes through the clinic a vaccination card that says what vaccine you were given, the lot number, and the details, and you can get your second dose somewhere else. It has to be the same vaccine. So where the issues can be ran into is if the other state you're going to is not carrying that vaccine. So there's Pfizer, Moderna, and they're not interchangeable. So there's some logistical pieces to that, but we can help you work through the questions around the second dose individually.
All right, that's all of our questions for the week. If people have additional questions, please get on to our Facebook page. I'll try to address those throughout the day today. But on behalf of Good Samaritan Hospital and Good Samaritan Fish Network, we'd like to thank you for being with us again this week, and we'll join you again in 1 week for an update.